When we take an impression, it's very important that we are very accurate and precise. Otherwise, we can have some troubles in the manufacturing of our restorations, and so we can compromise all our job. So, how to be precise and to be predictable in our impression taking? I want to share with you the 5 secrets, the 5 key points that for me are very important. The first one is the health of the gingival tissues, of the soft tissues, and so we have to consider that we have no bleeding, stable tissues, and very healthy. So in this case, especially when we have multiple abutment impression, we can call the patient in advance, maybe 1 week in advance or something like that, and we can control this kind of aspect. Maybe we can do an oral hygiene session before in order to be very, very predictable in this kind of situation. For sure, we are talking about this topic, especially when we have equigingival margin, the finishing margin, or when we can have in the intracircular margin finishing line. The second aspect is the retraction and the isolation of the field in the sulcus, especially when the finishing line is over the gingiva or close to the gingiva. In this case, we need to put a retraction cord. With the first retraction cord, we have an isolation of the field, and then in that crevicular area, and then also we can have this retraction that allows to us to see the extra area of the finishing line. So for us, it's very important to see the margin after the finishing line because we can have more details and we can be more accurate and precise. In this situation, it can be useful to have the second cord, as classically we know. I'm not using the second cord every time. I don't want to talk about this today, but the idea is to put the cord and to dry very well before to put the material this area in order to don't have any kind of liquids, any kind of bleeding, any kind of contamination with saliva. The third point that is very important is to put the light material on the sulcus, on the detail of our finishing line in a very, very accurate manner without any bubbles, without any inclusion of air. So in this case, usually we start outside of the sulcus, then we still injecting our material, maintaining the tip of our syringe inside to the material. And then we go around in this area, we can, with the gentle spray of air, set and spread a little bit more the material in this area, and then we can go at the medium or in the heavy body material for the next part. The fourth key point, the fourth aspect is represented by the position of the tray. If we use a standard tray, we don't have a specific customized position, but we have to try in before and then to reproduce the same position when we take the impression. And then we don't have to touch any abutment, any teeth if it's possible, so we don't have distortion, but we have to consider the space and the trying of the tray is very important. If we have a customized tray, we have some stops, and then thanks to these stops, we can try them before to take the impression, and in the second moment, when we want to record our impression, we reproduce exactly the same position that we have seen with our stops, occlusal stops. The fifth key point is represented by the stability position of our tray. So in the first minutes of our impression taking, we don't have to move in any way, in any kind of micro movement, our impression. So once we arrive to the position, we have to keep it stabilized for all the setting part, especially for the first part. This is very important because otherwise, during some micro movements, we are not realizing that we are creating some errors, we are deformating and we are creating some deformations, but we are doing. So maintain stable until the finish of the setting. This is the sharing of today. For me, it's very important to share this kind of goals and this kind of aspects during the impression taking because to have some problem in this phase, it means a big problem in the precision and in the final result of our restoration. If you like this video, please share it with your friends and see you next time. Ciao, bye bye.